Now coming to the how we should read a chest X-ray. There are many ways, different people follow different ways of reading a chest X-ray, but everybody should develop a technique or a pattern so that he may not miss. He may not miss and all areas may be covered. So first of all, when we get a chest X-ray, we should match whether this X-ray belongs to a particular patient or not. So the most important thing is that before reporting a chest X-ray, we should match the identification number and we should make sure that this X-ray belongs to that particular patient whose report we are making. Now, before proceeding to making clinical comments, we should analyze whether this X-ray has been optimally taken or not. So there are many technical parameters which should be evaluated before commenting on abnormalities or before actually reading the X-ray. So the most important thing is the marker. We should make sure that the marker is on the proper side, right side should be marked right side. The second thing is that a good X-ray should have, the patient should have taken deep inspiration or adequate inspiration. That we see by seeing that the diaphragm should be below the anterior end of the sixth rib. If the patient has taken adequate inspiration, the diaphragm usually goes below the anterior end of the sixth rib. So this is how we can comment that this X-ray, this patient has taken adequate inspiration or not. After commenting on the inspiration, now we should see whether the patient was standing evenly or not. There should not be any rotation because the rotation will make us commit a wrong diagnosis. So I will tell how to see rotation. Then we should see whether the centering was proper or not. Both costophrenic angles and both the scapula, they have been covered in a chest X-ray or not. And then we should see whether the exposure is optimum or not. The chest X-ray may be underexposed or overexposed. I will just explain you by showing images. After evaluating the technical parameters, then we should go to evaluate different structures. And there are many people, some people go from pathology to normal, some people go from center to outward, some people read from outside to inside. So there are many ways. But here one scheme is proposed, like we should start with the central structure like trachea. We should first see trachea, then we should see heart and mediastinum, then we should see diaphragms, then we should see pleural spaces or costophrenic recesses, then we should comment on lungs, then we should try to see hidden areas like areas of the lung which are hidden behind the heart, which are hidden behind the clavicules. We should see the mediastinum. We should then comment on the hyla. Then we should try to see below the diaphragms also. So below the diaphragms also, although it's the part of the abdomen, there may be findings. So we should also see below the abdomen like gastric fundus or presence of any free air like pneumoperitoneum. And then we should see the chest wall for bones and for soft tissue. So we should develop a scheme and we should follow a scheme regularly so that we may not miss any finding on the chest X-ray, and we should comment on each structures. So this is how first match the identification, then judge whether the X-ray has been appropriately taken or not, and then we should read the chest X-ray. Now as I told you, the patient should have taken adequate inspiration. So there are two chest X-rays on this slide. The first one, inadequate inspiration. The second one, adequate inspiration. In the first X-ray, you can see the heart appears enlarged. It looks like there is haziness in the lower lung zones. So we may think there may be pleural effusion or there may be subconsolidation in the lower lung zones. So before commenting on abnormality, we should make sure the patient has taken adequate inspiration. So this is the second X-ray is in proper inspiration. You can count the diaphragm is projecting below the anterior end of the sixth rib. So this is the effect of inspiration in a chest X-ray. Now coming to the rotation. How we should see the rotation? To see the rotation, we should see the spinous process, and then we should see the medial margins of the clavicule. Both sides, the medial margins of the clavicule should be at equal distance. The upper film is rotation, you can see the spinous processes have been highlighted and the medial ends of the clavicles have been highlighted, and you can see that there is no rotation, both sides equal. But the lower X-ray, you can see there is gross rotation. The medial end of one clavicle and other clavicle, they are quite away from the spinous processes. So this is also important. There should be no rotation ideally. Now coming to the exposure, as I told you, there are many factors while taking X-rays like KV and MS. So at the end result should be a properly exposed film. The film should not be underexposed. Like in the bottom image, you can see the heart is whitish, the lung vessels are prominent, and in the other film you can see all the lung is dark. You could not make out. So that the bottom images, the first image is an underexposed film and the other one is an overexposed film. But the top row image, you can see that is a properly exposed film. So how we know this is a properly exposed film? In a properly exposed film, we will see the intervertebral spaces through the top half of the heart shadow, but not through the lower half of the heart shadow. So this is one way. Although we can, by seeing only, we can judge this is a good exposure or not.